to Ms. McIndoo and Ms. Rankin, and of course, Ms. Rankin, we promised that we'd give you an opportunity, the two of you, during this last segment to talk about what we indeed consider to be something that is somewhat of a miracle, and that is this Juice Plus. And we've heard about it time and time, and I think it's one of the best kept secrets in the world. And what we wanted to do on this particular show today is to make our audience aware of it, because I think that you do have somewhat of an answer to some of the problems that you pointed out. Let's talk about that.
Well, I do want to point out, too, it is fruits and vegetable consumption that's important, and how Juice Plus plays a role in that. It is fruits and vegetables in capsule form. It's fruits and vegetables that have been picked at their ripest stage, which where the nutrients come in those last few days of growing. They have been juiced, the salt, the sugar, the liquid has been taken out. So you have a concentrated powder. So it's been encapsulated, so you can take 2 fruit capsules in the morning and 2 vegetable capsules in the evening, and it would have been like you would have juiced a wide variety of fruits and vegetables. Now, this is not to say that if you take Juice Plus, it's a magic pill and it's going to solve all your ailments. That's not what we're talking about. We're talking about helping people get on the road to better health and better nutrition. And certainly the synergy, I know, Lisa, you feel very strongly about the synergy plays a huge part in that.
Right.
Let's talk about that.
Okay. Well, they have been able to measure 10,000 phytonutrients in an apple, in an orange, in a tomato. And really, historically, what we've done is we've pulled some of those out and we've served them up in high levels and said this is what people need, because we've been able to see the effectiveness of some of those. And really, it's the synergy. They all work together. And so to say that 1 or 2, you know, are better than the others and pull them out, really what the data is showing is that it's better to get them all together.
Right.
And so that's what Juice Plus provides for you, is it's 17 different fruits and vegetables and grains that are whole food, that are dehydrated and put into capsule, a convenient capsule form. And so it makes it easy for people to help to bridge that gap between what they get and what they should get.
Right. And I'll just say, Dr. Haney, what has set our product apart from any of the products out there is the research that has been ongoing really for the last 9 years behind the product. It first started with bioavailability. Does the product get in? Yes, we know it gets into the bloodstream and work on a cellular level. Then we addressed the immune system. It boosted the immune system. That was proven not only in this country but in other countries. DNA, if we can literally repair damaged or the damaged DNA or reduce the damage to our DNA, how exciting can that be for an individual and for a family? And then certainly now, in the last 2 to 3 years, other institutions, MD Anderson are coming to us. There is a study being done right here in Nashville with Vanderbilt University, all looking at how Juice Plus, fruits and vegetables in capsule form, plays a role in the real health of the people in this country, and really now globally. We are operating in 30 countries around the world right now, and certainly it's all about educating people that there is something that they can do to be proactive in their health care.
Ms. McIndoo, what would you say to the state of Tennessee this morning in terms of dealing with TennCare and all of the problems that we have, and that might be a solution to what they're doing?
Right.
Not a complete solution, but a partial solution in terms of dealing with some of these things.
Right. Well, I would say that, you know, if we get back to the basics, if we get back to the garden, we are certainly going to reduce the amount of sickness that we have going on. And, you know, it could revolutionize the medical community and, you know, the amount of money that we have to spend. And certainly prevention is much easier. I mean, we've always heard, you know, growing up, an ounce of prevention is worth a pound of cure. And, you know, it doesn't relate any better than today, you know.
And can I just say that our own mayor has set up a health council. I was reading just recently, early this year, it was a focus to get Nashville healthier and to get us thinking more on healthy, and just get us in a number of ways healthier. So there is a thrust here in our own community to get a focus on healthy activities, healthy attitudes, and being proactive again, as I said earlier.
Very good.
We need to take control of our wellness.
Okay.
Because nobody else is going to do it for us.
We've got a minute and 40 seconds, a minute for you, a half minute for you, and a half minute for you. What would you say to our audience this morning, this parting word?
Well, I would say that get educated. You know, certainly after this program, you're going to be more aware. That's a part of it. You're going to pay more attention to the things that not only that you eat, but that you do. And we're, you know, people who are looking to be a part of an ongoing concern where they want to educate and certainly inform others, certainly could join those kind of ranks, being excited about telling others that they can take control of their health, and that's really what we've been doing.
Very good. Ms. McIndoo.
Right. Well, I can just say, again, how much it has helped our family and helped the children in school. Their grades have improved, and that's what we're seeing. We have a children's health study that's going on right now where we're studying the health of children after having added fruits and vegetables to their diet, and we're seeing great gains in educational performance, in physical performance, those types of issues. Children aren't as sick and they're not having to take as many medications. So the data is there, and it's just a matter of parents and adults and everyone getting a hold of this information and tapping into the process.
Very good. And let me, over the last 10 seconds that we have, ladies, thank the two of you for coming by and giving us that excellent information about this very, very important nutritional product, but more important, giving us information about wellness and how to stay well and how to get well. And of course, we'll be back with our audience next week for another informative edition of Comments. Thank you and good morning.